topic for the project was Students with Emotional and Behavioral Disorders by
Stephanie,
Emily, and Andrea. EBD is a term that encompasses many different disabilities, from ADHD to various personality disorders. The federal definition has 6 different categories. However, the definition is very vague and subjective.
many problems are associated with defining EBD as a result of many factors, such as different conceptual models in the field, different purposes for definitions, problems associated with measuring emotions and behaviors, the range or variability of normal and deviant/problem behavior, and the impermanent nature of many emotional and behavioral problems. There is also another classification system called the DSM, which is completely separate from the federal definition of EBD.
The DSM contains descriptions, symptoms, and other criteria for diagnosing mental disorders. It provides a common language for clinicians to communicate about their patients and establishes consistent and reliable diagnosis that can be used in the research of mental disorders.
EBD also affects academic achievement. Students with EBD drop out of school more frequently,
Have a pattern of underachievement,
Fail more courses in school,
are more likely to be absent from school,
and perform 1 to 2 years below their assigned grade level.
Many academic difficulties that students with EBD have are related to and caused by their inappropriate behaviors.
Two to 4% of students in a given school population meet eligibility criteria for EBD. However, only 0.92% of the population receives services for their disorder. That's less than half. Based on this statistic, it is clear that this disorder is incredibly underserved.
have students with emotional behavioral disorders in their classrooms suffer from many challenges.
Many students with EBD are not identified early.
Teachers are inadequately prepared.
There is a zero tolerance climate.
The behaviors may affect the learning of other students in the classroom.
And there's not enough collaboration with special education programs, psychologists, mental health service providers.
How can teachers overcome these challenges? The second part of our video will provide strategies for helping students with emotional behavioral disorders in the mainstream classroom. Children with emotional behavioral disorders commonly lack the impulse control and the emotional balance that is necessary to handle social interactions with other students effectively. This can be challenging for a teacher, especially in an inclusive classroom where only a portion of the students have emotional behavioral disorders. While this scenario can be quite challenging at times, there are some ways to make things better in the classroom. Students with emotional behavioral disorders can be moderated and controlled by implementing a classroom management plan that is tailored to meet the specific needs of these students.
It's important to do as much research as possible. Every child with EBD has different struggles. Therefore, different techniques will work for different students. This is where it's important to collaborate with colleagues such as special education personnel and counselors. Here are some crucial tips for teachers to keep in mind when instructing students with EBD. It's important to ignore bad behavior whenever possible, to be consistent with rules, expectations, to offer a lot of praise and encouragement and create a supportive environment, and to also combat any negativity with positive remarks. It's important to use plenty of hands-on activities, use art activities to provide an enjoyable outlet for emotion, and to incorporate physical activities and brain breaks, which can help channel energy. A part of the curriculum for students with EBD should include training in learning how to control antisocial behavior. Key skills selected for intervention are usually those identified as classroom survival skills, which are skills that promote positive peer interactions and those that provide problem-solving strategies. Classroom survival skills include following directions, completing tasks, making choices, and accepting consequences. Peer skills include joining a group, giving compliments, and learning how to play with others appropriately. Problem-solving strategies include negotiation, ignoring inappropriate behaviors of peers, and anger management. Teachers can work with their students to discern which levels and areas of social skills instruction are appropriate. One method would be to conduct a functional behavioral assessment, which we will discuss shortly.
One approach many schools have adopted is PBIS, or Positive Behavior Intervention and Supports. This approach applies evidence-based programs, practices, and strategies for all students to increase academic performance, improves safety and decreases problem behavior, and establishes a positive school culture.
With this approach, the teacher will teach all students self-management skills, use praise, practice proactive and positive classroom management, and utilize peer mediation and support.
Under law, students with significant behavior problems are entitled to a formal BIP. BIP is the design of appropriate and effective steps to stop undesired behavior. FBA is a part of a BIP. It is a process that identifies specific target behavior, the purpose of the behavior, and what factors maintain the behavior that is interfering with the student's educational process. The teacher must ask, is the behavior linked to a skill deficit or a performance deficit? This would require some extensive observations and data collection.
Educational and psychological literature on children with emotional and behavioral disorders indicates that this population is one of the most difficult groups to include into general education settings. The literature shows that inclusion continues to be a goal, but there is little research that explores what characterizes a successful inclusion plan that results in the child with EBD being able to cope and remain in the general education setting. However, every BIP plan is individualized, so the success of a child in a mainstream classroom is contingent upon effective planning and collaboration.
There are many adaptations that can be made to the classroom environment to support the needs of students with emotional and behavioral disorders.
Make sure all students' desks can be monitored.
Set up desks to lessen contact and disruptions.
Create quiet workspace locations.
Locate students with EBD near the teacher.
And move students away from tempting materials.
Anxiety disorders are among the most common mental, emotional, and behavioral problems to occur during childhood and adolescence. And a mind and body under stress does not internalize material as well. Teachers can use classroom meditation and guided relaxation to benefit students that experience these problems. In a study looking at behavior disruptions in a first grade classroom, adding a short meditation into morning meetings significantly decreased the disruptions in class over a month and continued to have lasting effects for the entire year.
So if you are wondering, can a child with a behavior or emotional problem survive in a typical classroom? Well, the answer is yes, of course. With the proper behavior plans, classroom modifications, and effective collaboration with special education personnel, any student can be successful in a mainstream classroom. We hope you remember these strategies during your teaching career.